If you were having a heart attack, would you be able to recognize the symptoms, or would you be in denial? It's something people want to think about or don't want to think about, but as part of our series Wear the Gown with UT physicians, one man hopes his experience serves as a warning to others.
I'm completely panicked. I can't make this pain go away.
Even as Jerry Van Orden felt a stabbing pain in his chest and a numbness in his left arm,
I got in the truck and couldn't close the door or put my seatbelt on.
he was still in denial he was having a heart attack. His wife urged him to get to an ER, but he was hopeful his symptoms would go away.
It was the longest 6 hours of my life.
Van Orden was moving heavy equipment around at his job at a local theater when he started experiencing the symptoms. He was heading home to lay down when he instead turned into a UT physician's clinic, a decision that ultimately saved his life.
He was sweating. He looked very uncomfortable. He told me he was having one of his anxiety attacks.
But his primary care physician, Dr. Aracely Vasquez, recognized what was really happening and had him transferred to a hospital. 12 weeks after having 2 stents put in, Van Orden says he has stopped smoking and made major changes to his diet.
A lot of chicken and fish. Now I can have 1 steak a month.
And he's getting back to doing the hobbies he loves. Dr. Vasquez says Van Orden suffered more typical symptoms of a heart attack, but wants people to be aware of less common signs.
Things like abdominal pain. I have a lot of patients that think they're having, acid reflux, indigestion.
Van Orden hopes his experience is a wake-up call for others, especially men,
When we're stubborn and all those things, I get it.
to recognize the signs of a heart attack.
You don't want to accept it. And then even while it was happening, I'm telling myself, no, this is not what's happening. No, this is not what's happening. You know in the back of your head that it is what's happening.